Hey, it's Dr. Myers. Maybe we should talk about a little rash that people get. This isn't a little rash, this is a big rash called Tinea Versicolor or pityriasis versicolor. This is super common. More common in young people like teenagers and young adults and whatever. It's worse in the hot times because this fungal rash kicks up more commonly when people sweat, when it's hot. And it's more common in the seborrheic areas. The seborrheic areas would be the chest. Even the scalp is considered this, but chest and back are way more common areas where you get this rash. This is a rash where a commensal yeast, it's part of our normal microbiome, flourishes, because some people just have this yeast proliferating more than others, then they can get this rash, especially when it becomes hot and sweaty. Since this yeast, which is called Malassezia, lives on lipids, it's more common in kind of sweaty areas. How do we know what it is? A lot of times you can do it by look, because you can look at it and you see people with either this pale type of rash that's in these spots on this area and that area, or in some patients it's more dark. Why is this rash pale on some patients? It's because it inhibits the production of melanosomes. So you tan all around it. In the areas where you have the yeast reaction, it doesn't pigment. It is more dark. It can be like this coppery color or a little bit red or more brown, and that's when the skin's a little bit more inflamed because of this yeast. How common is it? Very common. I probably see it weekly, and it's way more common than that. This is just to patients who make it all the way in to see us. So how do we treat it? Because this is a yeast that is part of our normal skin microbiome, which means we all have bacteria, we all have yeast on us. Most of these are good. We're not talking about the bad stuff, but of all the good stuff that is part of our makeup, this one just flourishes and is a nuisance. And so there's basically 3 great ways to take care of it. Number 1, you can use anti-dandruff shampoos. So in the shower, you basically clean with anti-dandruff shampoos. Selenium sulfide, ketoconazole, or other type of ingredients that basically inhibit yeast. So a little hint, yeast is involved in seborrheic dermatitis, which is dandruff, but that's not for this video. So using these shampoos during the shower is awesome, and they work good to kind of maintain it. What's next level up? Topical anti-yeast products. Would over-the-counter ones work? Probably. We do prescription ones like ketoconazole, econazole, oxyconazole, and other ones, cyclopirox. These all work great for smaller areas to treat this when it's flourishing. My favorite way is like a once or twice a year oral anti-yeast, such as fluconazole or ketoconazole or even itraconazole, which we use a little bit less, but all of those work from the inside out, and thus in like double dose that you take all at once, you can almost clear this over the next week. A lot of people do this at the beginning of the summer when they start to notice this rash. They'll take these 2 pills. Even there's some little tricks that we do to help get the yeast out to the surface of the skin, such as, sweating a little bit and then letting the sweat sit on around the yeast, and this can kind of help get rid of it quicker. So that is Tinea Versicolor. So common to see it. I wouldn't call this a yeast infection. I would call this a commensal yeast proliferation, but nobody really wants this to flourish, causing this color changes, causing itchiness, and so we treat it, and it usually does quite well. Hope that helps. Thanks for watching.